Okay, I'm standing between you and lunch, so I'm going to make this worth your time. I don't have PowerPoint. I do not have expert tips on getting into medical school like all the deans here, except to tell you my own story, and I'll tell you a little bit more about myself. But what I really want you to take away from this is that the hardest part, I forget who it was on the panel that said the hardest part about medical school is getting in. That is and isn't true. I think that it's definitely what you all are probably facing right now. I think the hardest part about medical school is that when I decided I wanted to be a doctor, I had this notion of what being a doctor was. And part of it was based on, well, now you might watch Grey's Anatomy or House, and you might think that that's something like that. We had this old show called ER, and that was way back in the day before Twitter. And so we thought, well, that's what medical school is like. And actually, it is a lot like that, because ER is probably one of the closest shows to what reality is. If you want to try to actually watch a show that's medically accurate, that's one of them. So I thought I wanted to be a surgeon. I thought the coolest thing I could do is be one of those people that gets to wear pajamas all day long, and that's my daily uniform, and I can just go to sleep like that, and I could cut, and I could make people better. Then I get to medical school, and then I hang around all the surgeons, and I'm thinking, I don't really like any of them. And so that's not a slight to any of the surgeons in the room or budding surgeons in the room, but I started to wonder what it was that I wanted to do. I had worked so hard thinking about going to medical school, and I'll just stop and tell you a little bit about my background. My parents came from India. And I tell people there are probably a lot of, whether you realize it or not, a lot of Asians go into medicine. That might be a shock to you. So if you haven't heard that before, but I was unlike most Asian families because my parents actually didn't want me to go to medical school. They had they didn't have a high degree of education in our family. So I was the oldest of 3 girls, and the best we could do was probably get married to a doctor, but not necessarily be doctors ourselves. So when I had a liberal arts degree, which was even more of a shock, because what exactly is a liberal arts degree? My father asks me still to this day. And so I disappointed them, I felt like, at every step of the way. And when I decided to go to medical school, I thought I would redeem myself, and oh, they'll be so proud. And my mother's only comment was like, "Beta, that's too tough. You need to get married quickly." So that was pretty much what I faced. But I persevered, and I did not know anything. I also heard one of the panelists say that your undergrad, I went to the University of Texas at Austin, a very, very big school, and thought certainly a lot of people went from UT Austin to medical school. I definitely agree with the advice, though, that don't depend on your undergrad advisor or counselor, even if you think they're awesome, to help you get into school. And I quickly learned, and I just applied to schools in Texas, I quickly learned that the truth of the matter, and I am a little older than you, so things may have been different now, but the formula really was our math science GPA and our MCAT scores. That determined, at least in Texas, and I know in California that's maybe similar, that determined our ability to get an interview. So the thinking was, if I can get past that initial process and get an interview, then I'm golden. And then that's when I can worry about making sure they know I'm a good person, and I'm not a baby killer, and I'm not a criminal, and I volunteer every day, and all those things that I know everybody's worried about. So that was definitely the case when I went to medical school. And so I got in, all that was fine and good. I show up on the first day, very excited, paying like obscene amounts of money for my books, and quickly realized that I didn't really like anyone in my class, and it was mostly because I felt like when I told you I wanted to be a surgeon and I had this idea of what a doctor was, I always had this feeling that what I really wanted to do was make the world a better place and help people, and all the questions that you get in your interview are these, I don't know what these mini interviews, it sounds like speed dating. It's a little frightening to me, but I wanted to meet people who were like me, and what I felt like and it wasn't just my school, but what I felt like I was in, and I had a class of 200, which is pretty large for medical schools, but in Texas is a standard size. What I felt like I was in was this little factory of little gunners who were just trying to, get the best grades, and they would post our grades Everybody could see what your grades were on some of our, we had tests every 6 weeks, and you could see who did well and who didn't. And I just remembered thinking, there's got to be more to medicine than that. And I didn't quite know. I made friends. There were like those of us that sat in the back row, and we all kind of hung out together, and we made friends and found alliances. And then I happened and stumbled upon AMSA one day, and I was like, oh, I had all these organizations that wanted us to join. The American Medical Association, the surgeons, the family physicians, the internists, the pediatricians, blah, 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 blah. And the thing that appealed to me about at least my chapter of AMSA at our medical school was that I felt like it could be whatever I wanted. It didn't say, come if you want to be a primary care physician, or come if you want to do X, Y, and Z, or here's what we do. It was really just an organization for students. And I thought, okay. And the person that was in charge was a little slightly kind of hippie-ish, and I thought, maybe she's, a little out there, and I can find some people who had a liberal arts past like me, and people whose parents also tell them they did the wrong things in life. And so I wanted to go to this meeting. I went, and I was kind of like, free pizza, that's good. And then I went to the national conference, which that year, the very first year I went to an AMSA national conference was in San Francisco, and I had never really flown to a conference, and I packed my little, I went to, I forget, I don't know if they have this store anymore, 579, whatever, and it's like Forever 21. So I went and tried to get the cheapest suit I could find, and thinking I needed to be all professional. I get there, and everybody's in t-shirts and shorts, and it was so relaxed, and I thought, finally, a place where, and people were talking about kind of why they wanted to be doctors and how they could capture kind of that spirit in their day-to-day lives, because they too all came from around the country trying to find someone else like me who just felt like they didn't belong at that time. And that's what I was looking for. And I was doing fine in school, and certainly since I've graduated, a lot of people have said, oh, well, you're, especially when I took a job in the Obama administration and worked in the White House on health reform, a lot of people have said, well, how did you get to do what you're doing? How do you get to work for, this great president and this person? And I tell people this story of, coming to medical school and feeling very alone. And I say all that to tell you the one thing I do want you to take away, that this is yours to carve and your path, and it will be painful at times, and you might feel alone at times, but it is something that you can work through and you can make it your own, and that's exactly what I did. And so I went through school, and I certainly, with AMSA, felt like I had a little bit of a lifeline. I had people that even if they weren't there with me every day, I could count on getting together with them even once a year and having, and this is really going to freak you guys out, email was new, so it was so early in the tech side that we actually had to call people on regular phones, and we had those big phones so nobody had a cell phone, and it was really kind of strange and sad. And so we would call each other, and we would just kind of complain, and we would just bitch about what we were enjoying, and our professors and I went to a traditional Texas curriculum medical school where the first 2 years were basic sciences, so it was having a lot of biochem professors tell me that I may not be cut out to be a doctor. And I felt like, this isn't what I went into medicine for. And so I worked through it, and AMSA certainly helped me survive. And so my first lesson is find people who can help you understand what's good about what you care about and what's good about you. And you may be somebody who goes and shows up that first day, if you're lucky to get in, and say, I think everyone here is great. I could be friends with everyone. I was the most popular person in my college, in my high school. Everybody loves me. I'm beautiful. That's great. But if you're like me and a good majority of the world, you may feel like the process of going through medical school can somehow make you feel less than yourself. And I certainly had to work through that. And then I fast forward, I got into a great internal medicine. So I decided not to be a surgeon, big surprise. But I was very good at surgery. I wanted to make a point that when I got to my clinical years, that nobody could say, well, she wasn't that good, and so she couldn't do what she wanted. And so I worked, the first 2 years I survived, The last 2 years I thrived, and my clinical settings were the ones that definitely distinguished me from a lot of the other students. And it had a lot to do with just the gut sensation that I had about what was right and what was wrong. And for those of you that know what I'm talking about, it's that same sensation that'll serve you really well with patients, because I started to develop this sixth sense about something's wrong with this patient, and I'm not smart enough yet to know what that diagnosis is. I don't know exactly what to call it, but I know there's something wrong. That is exactly what you need to do to be a successful clinician, and that's what I set my sights on. And it was really, really, really hard, because I still had my mother calling me, trying to set me up with, like, I don't even know what kind of boys in God knows what parts of the country. So you have to deal with, like, the personal side of that. And at some point, to get my mom off my case, I remember telling her, and I said to her, I'm like, I barely have time to shower. I don't think this is a good time for me to meet somebody. And so that got me through residency, that excuse. So then I applied to residency, and a lot of my AMSA friends, what was really fascinating is these people from schools all across the country became, and to this day, I won't tell you how many years ago it was, but you can do the math and look at the fine lines on my forehead and probably guess how old I am. But I will tell you that to this day, those people are still some of my best friends. And here's the crazy thing, they're all amazingly successful people. So we kind of self-selected to be this like really eclectic group that decided we wanted to be great doctors. We didn't quite know exactly what the hell we were doing, but we knew we wanted to make the world a better place. So a number of us are all around the country, some in other parts of the world, doing really amazing things. But it was AMSA that connected all of us. And no matter what, I would just tell you that what Jubin said about networking, I take it a step further. Just be yourself and try to make sure that even in conferences like this, as easy as it is to kind of be cliquish and stay with the people you know, take that chance to actually try to connect to something, especially because you know that at some point you'll need that to survive day to day to day to day. So then I go through residency, and I did a chief residency, and I was well on my way, and I actually stopped paying attention. I was very active in organizations. Obviously in AMSA, I was the president of AMSA, so I believed in the power of leadership. But when I went to residency in Portland, Oregon at OHSU, I decided very consciously to just put away everything that I had done and not participate in a lot of organizational stuff, because I wanted to just make sure that at the end of my residency that people knew that I was a great doctor. So I really focused, and this is interesting for me because my background is really health policy, and obviously I went to work in the Senate and in the White House, so I certainly didn't take a traditional clinical route. But I really wanted to make sure that in those 3 years for an internal medicine residency, it was the only time I knew that I could be a doctor and a student to the full extent of those definitions. I took care of patients, I made decisions that mattered, but at the same time, I was in an environment where I could ask for help. When you leave residency or a fellowship, even if you're in an academic center, you don't have that cushion as much. And I don't know how many of you work now with doctors, but we're really, really bad about asking for help, and we're even worse at saying we don't know. And I think that I learned firsthand how to balance being a good clinician, a great clinician, and also being honest with my patients. And so I do think that the role you might have, if you're lucky enough to get into medical school, you may think you know what you want to do, and you might be one of those few students who ends up exactly doing what you said you would do when you were a pre-med. I certainly wasn't, obviously. I didn't become a surgeon. But I think that what you should do is make sure that you concentrate on what matters, and it's the clinical stuff that matters. So you'll have to take your biochem courses, and you'll have to take them in step 1 and this and that, and you need to do that because you need to get past that gauntlet so you can get to the part that's really, really fun. And that's been the best thing that I've ever done, was make sure that I could concentrate. So then after fellowship, and I did a fellowship in research at UCLA because I really wanted to work. I decided I wanted to concentrate more on health policy when I was in medical school residency. That was right around when President Clinton was negotiating and the First Lady, Hillary Clinton, were doing healthcare reform. And so I was very interested in kind of how do doctors have some role in shaping what health reform looks like. So surprise, surprise, we didn't get that done in 93, 94, so I decided that at some point in my life, I wanted to work around people who made decisions the way that people got to in the Clinton White House and in that time period, which is now seems so long ago, but it was so important for what President Obama did. So I knew that I wanted to take some role. But I always lacked one thing that I didn't have. I had a lot of good network of friends that were like my age and my peer level. I don't think I took enough advantage of people who are older than I was to make sure that I could get advice. But when I did, I felt like every time I got advice from somebody, they were always giving me advice from the perspective of what they would have wanted or what they think is the right thing. So when I would ask my dean, who I really liked, I didn't like him at first because I really had this kind of notion that deans are people who don't really know the real world of what students deal with, and that may be true for some deans. I was really lucky that I had someone who actually kind of noticed that I was having a hard time adjusting or feeling like I was part of the class, and so he was very nice to me about just checking in every now and then. And then certainly when I had to take a year off to be AMSA president, I had to tell him. And of course, this was a great conversation. My mother called my dean, how inappropriate is that, about how I shouldn't take a year off to be president of AMSA because it's just wasting my time, so that I should get married and have babies. And so that was, so my dean gets this phone call from my mother, which is mortifying, but he handled it very well. So when my dean was giving me advice about what to do and what pathways and careers, he said, oh, you'd be perfect at, doing medical school admissions, and he put me on the admissions committee, and he kind of had this vision of what I would do. And I remember being so flattered that this person that was really important was telling me what to do, that I thought that's what I need to do. I'm going to be the next dean of a medical school, and there are like 0.5 women that do it, so this is great. And then I started to realize, actually, no, I don't like that. That's not what I want to do. But it took a while to realize that. So I do think that I feel like I finally kind of hit my groove with what I wanted to do when I got through a random series of events that had to do with people I knew through AMSA from years before. I got offered a job to work for Senator Ted Kennedy in the Senate when he was the chair of the Senate Health, Education, Labor, and Pensions Committee. So I was his deputy staff director, and he always had a physician who worked on his staff, and that was very important to him because he came from Massachusetts, had a lot of respect, obviously, for just health and health care, but he knew, like many other Democrats did, that no matter what, we were going to have to do health care reform at some point because it didn't happen in the Clinton White House, and it was just getting unsustainable. I mean, while those of you who work in clinics and hospitals, you see it still today firsthand, even though we've passed health reform, more and more people that have lost their jobs, more and more people that live in the shadows and are undocumented and don't feel like they can come out unless they need desperate health care. He knew it as well as anybody else did. So when I came to Washington and made my little career there, I was very excited and interested in how this kind of sausage-making process worked. Nothing I did in medical school could have prepared me for what actually was about to happen. So the other qualities that I gained in medical school and in residency and in fellowship and in some time when I spent doing clinical care, all of the qualities that kind of kept me alive through those processes served me very well. So not just the people skills, but also being able to kind of stay focused and stay calm and assess a situation. And then especially as doctors, what you have to do is take all this information that's hitting you from different directions and come up with a plan. And that's exactly what we had to do in Capitol Hill. We had to sort through all the noise, all the partisan politics, and come up with a plan for health reform. And this is when we thought that the next president would either be John McCain or Hillary Clinton. And so it was a really surprising turn of events when this, young Senator Barack Obama started to take on steam. And Senator Kennedy certainly, he assembled those of us on his senior staff. He actually brought us together at some point, kind of halfway through the primary process, and said, I just want to tell you all before it hits the news that I'm going to endorse Barack Obama. And I remember thinking, this is kind of like history for a Kennedy family member to kind of be handing over, in effect, this baton to a young black man to be the next president of the United States. And so it was wonderful, and I still live in Washington, it's wonderful to be witness to those events. And the thing that I kept remembering, though, was kind of what made me excited about being a doctor, because you can get swept up in all this, like, oh my God, it's Barack Obama, it's Ted Kennedy, it's these names and faces and people. And at the end of the day, what I knew is that nobody really kind of gave a crap about who I was. They cared about the fact that I worked for a very powerful senator. So I had to remind myself every day that somehow in my life, I had to focus back on what I wanted to do. So I went through the process. Senator Kennedy got very sick and then eventually passed away. And that's when I made the transition to the Obama White House to work on health reform. And someone asked me like how working on health care reform in the White House was. And I said, it was amazing. It was an experience I'll never forget, but I'm really excited to be a doctor again, because so much of what we had to do was deal with all the awful rumors and myths about who the uninsured were. We had to deal with death panels. We had to deal with town halls where people were throwing things at people who supported health reform. And at the end of the day, we had to convince the Democrats, our own party, that this was worth taking the blows, because at the end of all of it, we would make sure that we at least had 30 to 35 million more people with insurance. So I'll stop, and that's kind of my personal story, and I'll tell you just for briefly, and then I don't know if we'll have time. You're dying of hunger, but if there's time for one or two questions, I'd be happy to take them, or just make sure you can get some food. But health reform, I think some people have mentioned it or talked about it. Health reform isn't going to change what you're doing today here, trying to think about being a doctor. It will absolutely, without a doubt, no question, change the way medicine that you practice will look. There is no question in my mind that what we did in the bill, but also what was happening inevitably, whether or not we passed a bill, is exactly the direction that the country was going. And that is, we are no longer going to accept that people come to UC Davis for medical care for very complex, high disease, high complexity problems, and then get spit out after hospital discharges back into their communities with a stack of paperwork and very little direction and guidance. And that's not picking on UC Davis. It's just that anybody who's ever gone to a doctor can tell you, as some of you all have probably experienced, it's not a pleasant event, and it's certainly the most confusing thing that you could ever wish upon a person. And there's no reason for it. We can do banking, our banking industry, I can actually move, if I had a lot of money, I could move thousands and hundreds of thousands of dollars electronically, but I can't figure out if a patient I wrote a prescription for filled her prescription at a Walgreens down the street. So there was a real crisis that we were getting to. And 17% of our nation's economy was being spent on health care, and it was growing and growing and growing, and there was no end in sight. Meanwhile, people were losing jobs in the country, and that meant they lost their health care. So I had people coming into a free clinic that I was working at on nights, on Friday nights. I would start to see people who had very professional careers. I met a woman who was wearing kind of a very nice business outfit who came to a free clinic and said that she had lost her employer's health insurance. She was in her 40s, and she had had some prescriptions that she had let lapse because she didn't have a doctor she could see, and then she just started feeling bad, and she had to come in. Stories like that, over and over and over again. And I was doing this as a volunteer, but I was working on Capitol Hill, and I remember just one day after a bunch of meetings with Democrats and Republicans where everyone was just arguing over no public option, yes public option, no we want this, yes we want that. I just remember I actually like stood up, and I was someone who I chose my words carefully so that I wasn't like that loud, annoying person that nobody actually listens to. So I stopped and I got up and I'm like, this is bullshit. There are people out there who actually need health care, and I don't care what color they are, I don't care how old they are, how fat they are, how skinny they are, they need it. They need it today. They're coming into our clinics. There is nothing we're doing about it. And what are we all arguing about? Like, and I remember like the other staff in the room were just like, oh my God, there's something wrong with Kavita. She is really losing it now. But I couldn't take it, the disconnect. with Washington and just talking about the problem. And then in my little bitty time, I saw the problem, and I just remember wanting to, like, I'm not an angry person, but I just remember wanting to, like, beat my head against the wall, feeling frustrated. So the most beautiful kind of thing that I ever did in the White House was try to give people a reality check. I don't want to take credit for, there were a lot of people that worked on that bill. The bill was massive. Most people still don't understand what's in it, and that's a big problem. But I think that the most credit that I want to take for this, but I want to pass on to you, is at least some hope that you can do this too, is that I gave people some sense of what we're working for and why we're trying to get there and how much it means to so many people who had no voice for themselves. And the other thing I wanted to tell you, just to kind of stop and close, because I know I am standing in between you and lunch and sunlight and happiness, I do want you all to remember the work isn't done. So I had another person come up to me a couple of weeks ago, and I've left the White House. I now work at a think tank. What does that mean? That just means I'm really burnt out and I kind of need to chill out for a while. And so everybody who's burnt out in the government goes to a think tank, and we write books and we write articles and we give speeches and sound very smart, but eventually I have to sort out what I'm doing with myself. So I'm going back into clinical practice too, which is, believe it or not, like a breath of, for me, I'm like the most annoying person in my clinic because I'm happy and peppy and they're all tired and have been seeing patients all day, and I'm excited and to see a cough and a cold. So I'm doing that. But a couple of weeks ago, someone asked me, we did healthcare reform, so aren't we done? How do I get involved now that we've done like all the, really big stuff? This is actually, I mentioned to you that medicine will change on its face for what it is. This is actually the most important time to get involved, especially if you care about medicine, because all that stuff we pass that's on all this legislative gobbledygook, that has to get turned into something. And I got news for you. You don't want lawyers taking that and turning it into something. You want people who actually understand healthcare to do it, and that's you. And I know that some of you in this room are not going to get into medical school. That's just a harsh reality. When I was going through the process, a lot of my friends, there were some of us that didn't get in right away, some who chose to go out of the country to have a different set of opportunities. I will tell you, though, that there's so much need in healthcare that if it doesn't work out in the schools you apply to now, do not lose hope and do not lose sight, because the country desperately needs your expertise, and they desperately need people who care about healthcare. And there are so many things that I didn't know when I was a pre-med about different ways to get involved in healthcare that were not just being a doctor. And I say that because it can be the worst feeling, like a punch in your gut, if you don't get what you wanted and you worked really hard and you take Kaplan and all these things and Princeton Review, and I feel like my t-shirt was the only thing I got out of it to some degree, because I spent a lot of money and I'm not sure if it really helped me, but that's fine. But I do think that you need to remember that there is a way to kind of channel the passion you have no matter what the outcome is. And so the hard work is not over. There is a tremendous amount of need, and that even though we did pass this big bill and we will insure 30 to 34 million more people, we are still leaving people behind. There will still be people, and certainly our country has to deal with what we do with people who are not native born and who are not documented. And that's certainly a battle that I think that those of us who care about medicine and healing have to play a part in, no matter what your party politics are or your personal beliefs. So I'll stop there. Thank you. I hope you all can get to lunch, but